Welcome! This is episode number 73 of Birthwords. Today I'm going to be introducing you to a concept called communicative repertoires and what it can mean as you prepare for giving birth or as you support those who give birth.
Welcome to Birthwords. Words are powerful. What are you doing with yours? In this podcast, birth doula and applied linguistics scholar Sara invites you to be intentional, reflective, and empowering with your language as we come together to honor those who give birth. The work of Birthwords is to elevate the language surrounding pregnancy, birth, and the postpartum period. Nothing in this podcast should be taken as medical advice.
Hello and happy spring. I don't know about where you are, but here in Utah, things are waking up. The weather is warming up, flowers are opening, little green buds are appearing on trees, and my soul feels alive and happy. This is my favorite season change for sure. Along with all the changes outside, I have lots of projects and ambitions and other things that are opening and coming to life. And for that reason, I'm going to make this episode a quick and easy one today. I'm going to introduce you to a concept and ask you some questions that you can spend some time thinking and reflecting about, but this episode in itself will be pretty short. Hopefully you'll be able to ponder the things that we talk about and the questions that I ask and apply them to your life and your practice. But the time that we'll spend together today will be pretty short. So the concept that we're learning about today is called communicative repertoires. This comes from a linguist and educator named Betsy Rhymes. She talks about communicative repertoires to describe the different ways that we speak in different circumstances. So Rhymes writes, "A communicative repertoire is the collection of ways that individuals use language and literacy and other means of communication, e.g. gestures, dress, posture, accessories, to function effectively in multiple communities in which they participate." So again, communicative repertoires are the ways that we change our communication and all the different facets that go along with it, including our dress and our posture and gestures, to match the different communities that we're a part of. In short, we speak differently in different situations. So take a minute and think about how you speak and act differently in each of these settings. At home, talking to your spouse or partner about how their day was. At home, talking to your spouse or partner about finances. What shifts between those two situations about the way that you communicate? Let's keep thinking. If you have children, speaking with your children, do you communicate with each one the same? Do you communicate with them differently? And what changes depending on their ages, the topic that you're discussing, the setting where you're having conversations? What changes in the way that you communicate? Here are a couple of other examples. Ordering food at a restaurant. How do you communicate in that situation? What about opening a bank account? Okay, so in each of these situations, you might use a slightly different tone, a set of vocabulary, different levels of formality, different tones of voice, different facial expressions, different gestures. You might dress differently. You might hold your body differently in each of these conversations and communications. And this is not because we are inauthentic and we are true selves in some situations and are false or pretended self in others, but rather because we recognize that in different situations, we communicate differently because of the relationships or the perceived or desired relationships in that situation, and the goals that we have, whether personally or joint, in those communications. So let's talk about how this applies to birth. And I'm going to look at both the birth worker side of the coin and the birthing family side of the coin. So let's start with birthing families. Just as we talked about all those other situations in which you might speak slightly differently, now consider how you might communicate with your care provider as you go through pregnancy and prepare for birth. Consider how you might communicate with a doula who will be there on that day as you prepare for it. If you've given birth, think back on how you communicated during the process of giving birth. How do you communicate with nurses in the room? What relationships do you want to build? What relationships are you reflecting when you communicate with a nurse or with your care provider, with a midwife or a doctor or a doula? How do you communicate with your partner, both during pregnancy as you prepare for birth and during the birth experience? What changes in the way that you address each other in different situations, and why? What sorts of relationships are you trying to build? Now think, if you are a birth worker, how does this apply to the way that you communicate? How does the way that you communicate with other members of the birth team change depending on the setting in which you communicate? Whether it's a hospital birth, a home birth, or a birth at a birth center. How do you change your style of communication when you're communicating with your client and when you're communicating with, for instance, a nurse or an anesthesiologist or a midwife or an OB? Why does your communication change? What relationships does it reflect? And are those the relationships you want to be building? If you want to be working on creating different relationships, what role does your communication play? How can you differently position your relationship to somebody that you're communicating with to work towards a goal? How might those you are communicating with perceive your role and your relationship with them? How can you shape that through your language? How can your communication, including nonverbal communication, reflect and support the roles and the relationships that you're intending to build with your client, with other members of the birth team? How can you invite an open, positive relationship? Again, as I mentioned at the beginning of this episode, I am going to just leave you with those questions to think about, to consider. How does my communication style change in different circumstances? What roles and relationships does it assume? And are those the roles and relationships that I am intending to build? And if not, how can I change it? I hope you are able to gain some important insights as you consider these questions this week.
If you're interested in sharing your ideas or experiences on the podcast, go to birthwords.com. If you're liking what you hear, please leave a review on your podcast app. For more resources about language for a better birth, subscribe to the monthly newsletter at birthwords.com and follow Birthwords on Instagram and Facebook.